Hello, my name is Jenny Maypark, and along with Mary O'Brien and Mandy Wallace, we will be giving a presentation on bipolar disorder. How would you feel waking up every day not knowing what type of mood you will be in, asking yourself, is this going to be a good day or a bad day? Or should I just crawl back into bed now? People who've been diagnosed with bipolar never know what they're going to be doing. This disorder comes with a lot of anxiety, mood swings, and frustrations. So finding the right treatment to help is a must. Therefore, we will give you insight as to what this disorder entails and the phases and types you can be diagnosed as. We will also tell you about the most popular medications used to treat this disorder, and we'll also give you some alternative treatments that are out there. First, I will explain what bipolar disorder is and what the different types that are out there that you can be diagnosed with. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, and activity levels, and the ability to carry out daily activities. Bipolar I disorder is characterized by at least one manic episode, or mixed episodes, and one or more depressive episodes. Manic and mania is an unstable, expansive emotional state of mind, and mixed episodes are symptoms of mania and depression happening simultaneously. In most cases, manic episodes precede or follow depressive episodes in a regular pattern. Episodes are more acute and severe than other types of bipolar disorders. Untreated mania can last for a week or even months. The depressive episodes can last 6 to 12 months. Hospitalization can occur depending on the severity of the cases. Bipolar II disorder is defined by a pattern of major depressive episodes, shifting back and forth with hypomanic episodes, but not with no full-blown manic or mixed episodes. Hypomanic is a mild degree of mania, which means symptoms are less severe and do not last as long. Patients can return to fully functional behavior between episodes. However, patients have more depressive episodes and shorter periods of being well. Suicide is a high risk with bipolar II. Bipolar disorder, not otherwise specified, this is where a patient does not fit into bipolar I or bipolar II symptoms. The symptoms they experience may not last long enough or do not have as many, but clearly the symptoms are out of the patient's normal range of behavior. Cyclothymic disorder is a mild form of bipolar disorder. These patients have episodes of hypomania and depression lasting for 2 years. However, the symptoms do not meet the requirements of any type of bipolar disorder.
Next, I, Mary, will discuss the most popular medications used to help treat this disorder. There are 3 common types of medications used to help treat bipolar disorder. These include lithium, anti-seizure medications, and atypical antipsychotics. First, I'm going to tell you about lithium. This is a very popular form of medication used to help treat bipolar. It is used because it helps stabilize moods and keep acute episodes of depression under control. There are multiple side effects when taking lithium. Some of these may be weight gain, memory loss, hair loss, and an increased risk for diabetes. Next, I'm going to tell you about anti-seizure drugs. These may be used in combination with lithium or an alternative to lithium. Some common anti-seizure medications include valproate, Lamictal, Epital, and Topamax. All of these drugs are used to affect the neurotransmitter GABA and help stop nerve cells from overfiring impulses. The third most common type of medication used to help treat this disorder is atypical antipsychotics. These drugs help treat schizophrenia and help to stabilize manic episodes. Some types of atypical antipsychotics will also be able to help treat depression.
Hi, I'm Mandy Wallace. Now I will discuss the different alternative treatments that some will use rather than taking medication. Herbs and supplements such as omega-3 fatty acids, these oils may help improve brain functions and depression associated with bipolar disorder. Bipolar disorder appears to be less common in areas of the world where people regularly eat fish rich in omega-3s. Omega-3s appear to have a number of health benefits, but most studies are needed to determine just how much they help with the bipolar disorder. Magnesium, another supplement, several studies have suggested that magnesium supplements may lessen mania and the rapid cycling of bipolar symptoms. More research is needed to confirm these findings. St. John's wort, this herb is helpful with depression. However, it also can interact with antidepressants and other medications and has become a potential to trigger mania in some people. The amino acid supplement appears to help the brain function related to depression. It isn't clear yet whether it is helpful in people with bipolar disorder. As with St. John's wort, SAMe can trigger mania in some people. Psychotherapy is another therapy used as an alternative. Cognitive behavior therapy is you can examine how your thoughts affect your emotions. You also learn how to change negative thinking patterns and behaviors in more positive ways for responding. For bipolar disorder, the focus is on managing systems and avoiding triggers to relapse and problem solving. Interpersonal and rhythm therapy. Interpersonal therapy focuses on current relationship issues and helps you improve the way you relate to the important people in your life. By addressing and solving interpersonal problems, this type of therapy reduces stress in your life. Since stress is the trigger for bipolar disorder, this relationship-oriented approach can help reduce mood cycling. For bipolar disorder, interpersonal therapy is also combined with social rhythm therapy. People with bipolar disorder are believed to have an overly sensitive biological clock, that internal timekeepers that regulate the circadian rhythms. This clock is easily thrown off by disruptions in your daily pattern of activity, also known as your social rhythms. Social rhythm therapy focuses on stabilizing social rhythms such as sleeping, eating, and exercising. When these rhythms are stable, the biological rhythms that regulate mood remain stable too. Family focus therapy is another therapy used. Living with a person who has a bipolar disorder can be difficult, causing the strain in family and marital relationships. Family therapy addresses these issues and works to restore a healthy and supportive home environment. Educating family members about the disease and how to cope with its symptoms is a major component of treatment. Working through your problems in the home and improving communication also focuses on the treatment. Electroconvulsive therapy, which is also known as shock therapy, is an electric current that is sent through the scalp to the brain. It is used to treat people who are suffering from mental illness like bipolar disorder. ECT, otherwise known, is also the fastest way to relieve symptoms in people who suffer from mania or severe depression. ECT is generally used as a last resort when an illness does not respond to medication or psychotherapy. It is also used when patients pose a severe threat to themselves or others and is dangerous to wait until drugs take effect. Therefore, we can conclude that being diagnosed as bipolar has many ups and downs, but there are multiple ways to treat this disorder and put you back on living life to the fullest.
In summary, we have covered essential information behind this disorder and ways to help it, including the definition of bipolar, the different types you can be diagnosed as, different types of medication used to help treat this disorder, and also some alternative treatments used to subdue the mood swings and manic depression. Now, having a better understanding of what bipolar is, you can help out someone that you may know who is struggling with this disorder to help him or her live life to the fullest and be happier.